Bonjour à tous. I am Laila Hessissen, a pediatric oncologist in Rabat, Morocco. I'm the president of the African region of the International Society of Pediatric Oncology, also known as SIOP.
Hello, I'm Daniel McKenzie, the Executive Director of KidzCan Zimbabwe and the Chair of Childhood Cancer International's African Region Committee. Laila, it's Gold September, the month when we champion childhood cancer awareness. What advances have been made in the treatment of childhood cancer in Africa?
Thanks, Dan. The World Health Organization sponsored Global Initiative for Childhood Cancer aims to achieve a 60% survival for all children in the world by 2030, and SIOP is the key partner in that effort. In Africa, we face many challenges to achieve that goal, but what we have learned in French-speaking Africa is that if you want to go fast, you go alone, but if you want to go far, you go together. We have worked together to standardize treatment protocols, coordinate our activities, and train personnel collectively. Then Zimbabwe also has many challenges. Tell us about them and tell us what you have done to overcome them.
Thanks, Laila. I am proud to say that 2 newly trained specialists have just returned to Zimbabwe to lead our pediatric oncology service. And broadly speaking, we have a dedicated treating team, a wonderfully engaged parents, and we do struggle with access to the necessary treatments. While there is limited access to surgery and radiotherapy, we struggle to access the chemotherapy agents needed to treat common and curable childhood cancers. So Laila, how can people help families on their journey or on their cancer journey?
Well done. There are many ways to support children with cancer and their families. This can be an employer in the community, a teacher at school, or a friend in the neighborhood. The journey is tough, and every little gesture and every piece of assistance helps. And supporting every effort to lobby government and the private sector for help would be an enormous value. Then, should we be asking parents to buy chemotherapy for their children?
Thanks for asking, Laila. Definitely not. The childhood cancer journey already places an almost impossible burden on families. We need to knock on the right doors to provide essential drugs and find other ways to achieve 60% survival rate by 2030. So let's all come together to help make a difference to children suffering from cancer, especially this month of September, which is Childhood Cancer Awareness Month.